Welcome to the Neurogenic Integration Podcast, where we explore the incredible potential of neurogenic tremoring beyond the basics. I'm Alex Green.
And I am Sylvia Song-Shields. Together, we'll be diving into how this natural, innate process can be seen and applied across different professions, healing modalities, and in scientific research.
Whether you're a practitioner, a coach, a therapist, a bodyworker, or a researcher, this podcast is for you.
Join us as we uncover the science, share experiences, and explore how neurogenic integration is revolutionizing the way we approach stress, trauma, and well-being.
So take a breath, get comfortable, and let's dive in. Hi, everybody. Welcome to the Neurogenic Integration Podcast. I'm Alex Green, based in Boulder, Colorado, and I'm sitting here today with Ágnes Katona in Budapest, Hungary. And she's our guest and somebody who I'm working on a major project with. And so I'm excited to sit down and have a conversation with Ágnes. But Ágnes is the owner of a business called Balanced You Therapy and Learning Hub in Budapest. And she's a physiotherapist, a manual therapist, and a certified TRE provider, TRE being the neurogenic tremoring that we talk about so much on this podcast. And she's been integrating tremoring into her physical therapy and manual therapy worlds, which is a big interest of mine too. So that's part of what we're going to be discussing. Welcome to the show, Ágnes.
Thank you, Alex. Thank you for having me.
Very good. So what we are working on is that later this year in September, Ágnes is hosting me to present a 4-day seminar for bodyworkers and manual therapists about tremoring. And in fact, the title of our seminar is Neurogenic Tremoring for Manual Therapists and Bodyworkers. And what this program is a way of bringing the information about neurogenic tremoring that many of us know from TRE or related approaches. So taking the neurogenic tremoring and bringing it into the hands of touch-based therapists. And so our audience in September will be physiotherapists, manual therapists, massage therapists, anybody who's a touch-based practitioner is who's going to be in our room together. And so what I thought would be really fun to do in a podcast conversation like we're going to do here today is for Ágnes and I just to kind of compare notes a little bit about our journeys and our stories, because both of us began as touch-based manual therapy practitioners who then learned about neurogenic tremoring and then came to the conclusion that it's a very important awareness and skill set for bodywork therapists to have as part of their toolkit. So that's what we want to do, is just sort of, what is our stories, and then we'll share just a little bit about kind of some of the also, there's ways in which the fields of physical medicines like manual therapies and nervous system approaches that they're starting to come together increasingly. So we'll talk a little bit about the Fascia Research and the Fascia Congress that happened last year, where Stephen Porges from the nervous system world and Robert Schleip from the fascia connective tissue world came together in a presentation talking about the integration of those things. And so that's some information we're going to be sharing in our seminar in September. And so we thought it would be fun to do a little bit of conversation about that here today. So that is kind of a preview of what is on the menu for today's conversation. Do we have time for all of that, Ágnes? What do you think?
Absolutely. I'm just really excited to just get deeper into this topic.
Very cool. Well, let's kind of share our stories, and let's start with you, because what I'd like to hear for you is just kind of a little bit about your own professional journey. What even drew you into physical therapy, manual therapy, a little bit about kind of that professional journey, and then how neurogenic tremoring got on your radar. Maybe did somebody tell you about it? Was it something you saw in your patients. So yeah, let's just start with your story.
Yeah, sure. So I'm basically a physical therapist. So this is how I started my journey, since I've always wanted to do some sort of nice job, and I was very interested in biology and human body as a child. So I was really searching for something that is a nice profession to work with the human body. So I first started working as a physiotherapist, and I met a lot of clients with very complex issues and complex symptoms. And physiotherapy is very helpful, but I kind of felt like that there was a missing link, something that is kind of missing from my therapeutic tools. So as a physiotherapist, I was kind of looking for something which is more holistic, which has a more holistic approach. So in Hungary, when you have a degree in physiotherapy, you can become a manual therapist. And I thought that this is a nice way to kind of expand my knowledge and expand my holistic view, and just to get something which is a deeper tool and deeper assessment, and just a deeper way of approaching my clients and the human body. And it helped me a lot. Eventually, I learned a lot about how I can use my previous knowledge that I gained as a physiotherapist in my practice. And it was really, really helpful until the point, because I'm kind of curious person, and I'm always looking for and searching for something additional that I can just add to my job, that when I started using the manual therapy tools, I felt like I am kind of good at my job, and I always got a feedback that I could help in very difficult and complex cases. The patients were really grateful for the job that I did, until the point I met some clients who were even more complex than I met before. So complex means that they didn't just have like a simple symptom. They also had like a complex systematic problem, which meant that in the therapy, we were working together with manual therapy techniques. We were working together with some exercises, but after some sessions, we kind of hit a certain point where we couldn't go further with the therapy. And however, I was able to help a lot to those clients, but I kind of felt like, okay, there's still something missing. And when I was a child and I had to pick what I want to do as an adult, what profession I would like to choose for the rest of my life, I was, as I said, very interested in human body, but I also was interested in what is under the skin, what happens inside, how our emotions, how our thoughts actually work, and how they are interconnected. And I never really gave up my interest on looking for something beyond the human body. And these clients kind of just showed me that it would be really important when we work to have an additional knowledge, not just about human anatomy, not just about the joints and ligaments and the tissues and the fascia, but also how our body is kind of connected to what actually happens to us, how my life, how the environment, how the stress, the trauma that I might happen to experience has an effect on the human body. And this is what I eventually discovered during as a manual therapist. that for many clients, it is really helpful to work with the body. But in some cases, in some more complex cases, actually the body involves more from our story. And we meet a client on the treatment table, not just by their symptoms, but we meet them with their whole story, with their whole life. And that has a huge effect on the body itself. Yeah, so pretty much this is how, as a manual therapist, I was looking for some additional techniques or something extra that I can just integrate into the job that I do. I knew that it should be something which has a connection with the human body, but which goes beyond the human anatomy that I already studied. Yeah. So at one time, I had a client, a very nice client, and she came to my practice. She was having some jaw issues and some other issues with her body. And she was telling me about, oh, Agnes, have you heard about that? There's this technique, it's called TRE. I've just heard about that, and actually it works with the body and it works with some sort of shaking. And I got really curious, like, okay, wow, I haven't heard about that. And what did you hear about that? Or where can I actually just gain more information about that? Yeah. And she just sent me through a website, and then I started looking at like what is TRE. And then I booked an appointment with a TRE provider because I got so excited about the technique that I really wanted to have a personal experience. How does that look like? How does that feel in the body? And I got really amazed after my personal session because the tremoring that I experienced, it was on one hand, very amazing for me, like, wow, okay, this is something that is a technique and that actually can be used for helping clients and used as a personal tool just to work with my body and work with stress experiences, trauma experiences. Right. And on the other hand, it amazed me because, however, it was something new that I tried, but it was also something very similar. Because I just remembered at that session that, okay, I think I've already experienced this kind of shaking and vibration earlier in my life. And it was very reassuring just understanding that I experienced earlier something very natural, something which is part of my body, something which is part of my human anatomy, which is part of also my nervous system. Right. And I felt amazing because earlier I thought there was something wrong with my body. I always felt like shaking is something that I should be ashamed of. This is something that maybe something is not working good in my body. Maybe there's something wrong with my body or something wrong with me at all. And at the end of that session, I understood that, okay, there's nothing wrong with my body. There's nothing wrong with me. This is a completely natural working of my body. This is a completely natural way of my body expressing something, which eventually helps me to get more balanced. And I was so amazed after that session that I made the decision at that moment that, okay, I think this is the missing link. This is something that I would like to learn. So at the first time when we had in Hungary the first TRE training.
Hmm.
I applied for that course, and I was really excited to become a TRE provider, so that
Right.
I can use this tool also in my practice to help my clients with more complex issues.
Wow. Very and amazing, amazing sort of journey leading up to it. But I'm curious a little bit about your personal experience. And yeah, no, I appreciated how you shared that when you tremored, you thought back or you remembered back to some experiences when you had tremored as a young earlier,
Yes.
and it helped you understand that that was natural, it had been healthy. It wasn't a bad sign. Actually, it was a good feature of your biology and all of that. But in your first, let's say, first few months, like you had that one session and you loved it, and then you joined the training. But what do you think your personal benefits from TRE was in the early days? Like, what were the biggest effects for you personally?
I think more than one thing. Uh, First of all, I really liked that I have a tool that I can use on my own. I always prefer, even as a therapist, gaining some tools which can be offered for the clients for personal use. So I really liked, and I thought this is amazing that it is so simple to use it. I don't need any kind of equipment. I just need my body if I want to practice. So I thought maybe this is not too romantic, but I thought that this is a practical tool and it's so easy to use. So this was one very personal experience at the very first few moments when I started using. Also, I'm not too flexible, or I thought I am not very flexible. So, of course, as a physical therapist, I could kind of like see my body changing. I could see like how those tissues can get more flexible, how I can actually find more flexibility in my body,
Mm.
how I can do movements that I couldn't do earlier, how I kind of have an overall feeling like my body is lighter.
Mm.
And it was a really nice experience about my body. Uh, Another thing, and it was a kind of shocking experience, but also beneficial, that before TRE and during my training as a physiotherapist and manual therapist, I attended quite a lot of course just to work on myself. I always thought that someone who is a professional, who is in the field of helping other people, it is necessary to work on ourselves, to work on our history, work on our traumas. So I visited quite a lot of courses. I tried many techniques which aimed to work with stress and traumas that I had earlier in my childhood. And I really thought I was very sure that, okay, I think I've done quite a nice job. I think I worked pretty well on my history. And I remember one time I was practicing TRE at home, and that moment hit me so hard. I can remember clearly, even today, that it was just a very deep felt sense in my body, and also a recognition that, oh my God, I was affected by so many difficult stories in my life. And eventually my body still remembers it. And I never thought how affected I was in my body. And I can remember clearly, like when when you look at the sky and there are like clouds, and those clouds just go by, and then the sun comes up and you just get like a very clear idea about what's happening. And I remember that I got that clear idea that, okay, this is amazing, like how my body was participating in all these stories. And the challenges that I still might have, it's because I never really paid attention on my body. And I understood at that moment that everything which is part of our story is part of our body. And even when we are kind of trying to live a life with a conscious life, when we are trying to be very conscious about how we integrate our history, we always pay attention on like what's happening in the mind, how we kind of reframe our story, but we never really pay attention to our body. And that was a really personal experience, the moment when I felt in my body the importance of working with the body, even when we are conscious, even when we have a history of therapy, even when we have a history of working with our family history and traumas. So that was a really great moment that I still remember very clearly.
Cool. That's great. Um, I love that. Well, so let me share. I'm gonna answer the same question about sort of kind of how I came to it and how I found it. But then I have a curiosity for you. So
Okay.
let me kind of share a little bit my own story, and I've told this a few places, so I'll try to give a short version here. But for me, my original body work training was through the structural integration tradition, so kind of the Ida Rolfing style approach to myofascial work. And for me, the before I even was trained as that, my first tremoring experience happened organically when I was in my early 20s, and I had a kind of a hip issue, and then somebody uh, took me through the 10 session series of structural integration. I'd never had any sort of body work or anything like this before. Um, but for me, this was kind of my big, I guess I would call it a somatic opening, because it's when I first discovered, a little bit like you're sharing, that um, when you work with the body, so much is there, not only the physical issue. In my case, there was a kind of um, an imbalance in my pelvis and my hips, but then it was connected to, as it turned out, it was connected to my the history of my body and my nervous system and everything that kind of went with it. But what happened for me was when I was receiving this work and I was laying on the table, and I was laying in a position that we actually use in tremoring and TRE, where the knees are up, where the knees are up and the feet are flat.
Mhm.
That's how I was laying on the bodywork table. And then my therapist, bodywork therapist, was working in my ribs. And so I was
Okay.
kind of breathing and my legs were up. And then my
Yeah.
legs, on their own, my legs started to kind of do this. And
Okay.
I kind of looked at her. I was like, is this normal?
Mhm.
Is this okay? And she's like, that's okay. This is just some sort of release, go ahead and let it happen. And she just kind of kept doing her work. Well, so I relaxed more, and then I started to get more of this movement, and then it kind of grew from there. And then I ended up having, and I definitely didn't know anything about TRE or didn't know anything about the nervous system. I had not studied the human anatomy. I mean, so this was all totally new. But I had this very big experience, and it was probably 10 to 15 minutes. I don't remember exactly, where my body and my spine and really had this big release. And I felt very, very different afterwards. Emotionally, I felt lighter, as you shared. Um, but I was so surprised by this. What this came out of nowhere, but it somehow felt very important. So it really sort of made a strong impression in my consciousness and brain, because it was so unexpected, but it was so powerful in a way.
Mm.
Um, well, so later on, about maybe 7 years after that, is when I became more and more interested in body-oriented work, and so I trained in this. I became a structural integration bodywork practitioner. And what was interesting is I had remembered that experience, and then as I started to work with people, and in the style of work that we do, if somebody's on their back, their legs aren't just lying long. We always have their knees up. It's just part of
Yeah.
the approach of this particular style. And because of that, not every client, but sometimes I would see a little bit of a tremor, or sometimes a bigger, more significant tremor like had happened for me. And so this became a somewhat regular occurrence, but I still didn't know very much about it.
Mhm.
It wasn't part of the training. All we said is in a way, at the most, my teachers would say, "Oh, okay, that's a release," but there wasn't much more than that. So I was very lucky because, like you, one of my clients said, "Hey, have you heard of this work, TRE?" And I said, "No, haven't heard of it." But then she ended up becoming training in it and becoming certified, and I offered to be her practice person for one of her tests or something like that. So then this was how somebody guided me through the TRE process. And then when they did, I was so excited because it basically duplicated the same
Mhm.
thing that had happened, 7, 8 years before, and created the same, what I would see sometimes in my clients. And I was like, oh, good. Somebody else knows about this, but not only do they know about it, they know how to reliably make it happen. Somebody has also studied the neurobiology. Why does this happen? How to do it, not just because I always say, not just have it happen when the stars align in the right way, but to have it happen on purpose. Um,
Mhm.
and so this was kind of my first opening, and then Dr. Briselli was coming to where I lived. This was near Chicago in the United States. And then, so very soon, several months later, I was already doing the certification program and working with that. But so for me in my early days, and this is what I want to hear from you in a moment here, is because I was already a body worker, and then I learned tremoring, and I thought, wow, this is amazing. And so I started to just introduce it to most, if not all, of my clients. And I experimented in lots and lots of different ways, in the sense of, with some clients, I would teach it to them separately. I would ask them to do it independently, or I would have classes. Um, and in that situation, I made the observation that even if somebody never did tremoring when we were doing our body work, I still found that the body work I was doing was happening much more successfully, and that I was mostly doing the 10 session series body work, or John F. Barnes style myofascial release work, that people who
Yeah.
were tremoring um, on their own or in a class or something, they were much more likely to have their muscles release. Uh, uh, and I would always say that it warmed up their nervous system, or it warmed up their body. So instead of working on, I don't know, I sometimes have very simple ways to explain things sometimes. I used to say, there's people with sort of cold bodies, and there's people
Mhm.
with warm bodies. And what I meant by that was, a cold body to me was somebody who wasn't very sensitive yet. Maybe they had never done much yoga or breath work, and so they weren't very connected to their body yet. And so I knew from body work that we could wake them up in their body, and this would take some time. Whereas that's a cold body. But a warm body is somebody who has kind of, in a sense, woken up their sensation, maybe, again, maybe through yoga, dance, um, lots of body work. Somehow they have more body awareness. And people who have more body awareness, in my experience, the the benefits of structural integration, myofascial release, visceral manipulation, all the things that my bodywork tools, they would happen much better as somebody became more awake inside of their body. And so with some of my clients, the ones who were tremoring 1, 2, 3 times a week on their own or in a group, uh, they were making progress way faster. Their muscles were relaxing. If there was any like guarding or emotional holding, being able to release that, maybe have some tears or some anger or something coming in, they were much more likely to have this happen. So that was one thing. So then I thought, well, okay, but what if not only if they do tremoring a little bit independently, what if while we're working, I'll just show some, I'm not going to take them through the 7 exercises of TRE, but what if I show them in a simple way, right here, right in our treatment room, how to wake up the tremor? Would that be a good format? And actually, could I use that inside of my bodywork sessions with much benefit? And I found out that this was very, very useful to do. And sometimes tremoring was a large part of a 60 or a 90-minute or a 120-minute session. Sometimes it was, a major piece. Sometimes it was a few minutes. Sometimes it was the integration of things. And so I really started to explore the different ways that a bodywork therapist could work with tremoring in the treatment room and outside of the treatment room to support the overall goals. And I love what you said earlier about looking for something that was a bridge into something kind of holistic, not just about the fascia and the muscles and the those systems, but something that might connect us into what we might say is the mind-body connection, or the emotional system, or
Yeah.
the nervous system. And that's what I found, is that I suddenly went from being somewhat a mechanically oriented person to, yes, there was still the mechanical treatment, but it now fit into this larger container that was much richer, had more benefits. Things happened more quickly. People had a tool they could do forever to regulate their nervous
Yeah.
system. So this was kind of, how this really developed for me personally. So that's what I'd love to kind of hear a little bit about from you is, after you got certified, you had your personal experiences. Now you're starting to introduce it to your clients, physiotherapy, manual therapy clients. And I would love to hear for you what you discovered. How did you work with tremoring? What were the benefits of it? Did they like it? Did they think it was weird? Share, just please, yeah, share anything you can about that part of the journey.
Yeah, okay. I just loved this whole story you just explained and how you discovered the TRE process. Some some of them is very similar to what I experienced in my practice, and some of them are not. When I became a TRE provider, I started to integrate TRE and tremoring into my practice, as you said, first separately, like as a separate individual session,
Right.
because this is how I was taught how to do that, just do the exercises, and this is how we kind of like help the client to start tremoring at the beginning. And I thought it was really useful. And however, I had the same patients coming, so it was an additional tool that I could offer. Like, okay, we have now this on the plate. If you feel like, you can give it a try, and I have great experiences. Let's see how it can help your life and how it can help you recover from the injury, from the surgery you had, also from the back pain that you've been suffering from for a long time. And of course, the very first impression was always like, oh gosh, this is so weird. So I never thought that my body does something. And they were really surprised at the beginning. Okay, I can feel the shaking. I can see the shaking, but does my body really does this automatically? Is it something that it just happens itself? I mean, I'm not doing it. My body does that. How is it possible? So yes, they were really surprised at the beginning. The first sessions were always like fun for them. Like, okay, it's interesting that it happens, but also they found it very beneficial. So even after one session, I always got feedbacks like, okay, I never expected that, but for example, I could sleep over the night, which never happened earlier, or I felt so much calmer that I can even recall when was the last time I felt calmer. And of course, it was very beneficial for the bodies and it was beneficial for me and interesting to see that the clients who came back for a therapy session or who were like coming back after one treatment, usually I always had to not start from the beginning, but the treatment never lasts completely after they came back for the next session. And it was really amazing to see, even for me and even for my clients, that, okay, we are starting from a different point this time. We don't have to like really get back to the starting point, which was a general pattern. So this is how I started to use that. And after a while, when I got more experienced offering in my practice, I just had the feeling at certain times when I had the clients on the treatment table and I was doing manual therapy, like, okay, this is a position and this is a situation where it would be so great to have the tremoring included. But how do I do that? Because the sequence I was taught that we have the exercises, then we just go on the ground and then we start shaking and tremoring. And I really like thinking. So I was sitting at the treatment table and I was like, okay, what's the aim of these exercises? Why do we do that? What is it helping with the body? Or how do we help with these exercises? Through these exercises, what we are trying to reach. And I thought that maybe what the body experiences through the exercises is kind of similar what the body experiences through the touch. Because when I touch the body, I try to offer a nice environment. I am not using like harsh techniques. I use the soft skills of manual therapy. I prefer those techniques. And I was thinking that, okay, I'm actually using my hands to give that nice environment and that safety to the body, which we are eventually trying to do with the exercises as well. So what if touch or those techniques that I'm using at the very beginning of the session are kind of equal to the exercises that we use when we are practicing TRE. And I thought that, okay, this might be something different than I was taught, but I felt like I'm gonna give a try. And as the patient, I was like asking for the permission if it is okay that I would like to try something. And I explained what's going to happen, and I explained about tremoring, and I was explaining what is my goal with just giving a try.
Sure.
So I had that client on the table after doing a few manual therapy techniques, and then we started doing the hip exercise, the very last exercise of the TRE exercises. And then I was really surprised because tremoring appeared, shaking appeared without the exercises. And the client was surprised as well, but she was totally okay with that. And it was amazing seeing how actually that very specific symptom kind of dissolved on the treatment table, integrating the tremoring into the session. So I made this choice because I was working with a body for a certain time, and I felt like, for some reason, I just don't think that I can reach very something useful today at this session,
Mm.
and maybe I need something additional. So I made this decision that, okay, let's see. I just give it back to the body, who I am. I don't know everything, so let's just
Yeah,
see how the wisdom of the body can actually solve this issue.
right.
And it happened on the treatment table. So after a couple of minutes shaking, the client kind of get rid of the that really tense muscle that I was struggling to solve with manual therapy.
Yeah.
And after that, she felt much better. I got a feedback that she felt amazing after that. She was so calm. And that was my very first experience, like, okay, maybe this is another alternative way to do or to practice or integrate tremoring into the work, the manual therapy that I already use with the
Doing.
clients. Yeah.
Very cool.
Yeah.
Well, let me ask you another curiosity. So, in your training, extensive training in physiotherapy, manual therapy, um, was tremoring recognized as something that could happen sometimes during treatment? And if so, if that was mentioned or recognized, what kind of explanation was given?
This is also a missing part of education in Hungary. We never really talked about, or it never was mentioned, that tremoring or shaking can be
Can
something
happen.
happen. And but it can happen, but we always talked about it as a sign or a clue of something which is not healthy, like a
As
symptom
something's
of,
wrong. Yeah,
yeah, there's something's wrong.
yeah,
This is a sign of some sort of neurological
yeah.
nervous system.
A neurological issue of some kind.
Yeah, yeah,
Yeah,
yeah, like
yeah,
Parkinson's disease or something.
yeah.
So we never uh, had anyone talking about that, and I never heard about that. That's why I explained earlier that when I had that personal experience in my life, I thought there was something wrong with me, because no education was about tremoring can be something useful or helpful as well.
Okay, well, all right. So that gives me I have a good example of can I share a little case
Yeah,
story here?
please, please. I would love to hear that.
Well, so this was several years back, and I was working with a woman came to me for Bodywork. Uh, she was a few years postpartum. She had had one child and had had it through cesarean. I think there was some sort of birth,
Hmm. Hmm.
some sort of difficulties. And uh, what she was coming to me for was basically just body discomfort, uh, postural patterns, pain patterns in her shoulders, lower back pain. She was having recurring, she was doing pelvic PT because some pelvic floor instability and some
Hmm.
issues and things. But basically she came wanting to feel more comfortable, wanting to feel more comfortable in her body. And so she initially came in, and my plan was to take her through the 10 session process of structural integration,
Okay.
which is a very comprehensive sort of manual therapy approach. But in my first session, while I was first session or two, as I got to know her, heard the story, do some work, and I observed, I felt, just wow, this is a person carrying a lot of tension, a lot of stiffness up in here. As she was on my table, not very much breathings, very shallow breathing, um, and and so to me, it was an example of a body that was very much on guard, sort of a guarding. There was pain, so it makes sense that she would guard. She'd had a bit of complications with the pregnancy, so her body was in kind of a guarding mode. And
Mhm.
so I didn't, in my first session or two, I usually am not trying to do, I don't usually begin going right into the myofascial work. Because I'm a nervous system uh, approach person, I tend to start a little bit gently, just getting to know that person's, in a sense, their autonomic rhythms, their breath rhythms. And so because we were working sort of slowly like this and just doing some quite gentle things, so some of structural integration is not as gentle, but I always begin with some, very gentle kinds of work. As I did that, I saw, like for me, I saw just the beginning, tiniest amount of vibration. I can't remember where, in her leg or her
Mhm.
arm or something like that. And so I brought it to her attention and said, "Oh, can you sense or feel that?" And at first she couldn't. No, she didn't really know what I was talking about. Okay, that's
Mhm.
okay. And then it became a little bit more. I'm not talking a full tremor yet, but just you could see that there's this sort of a vibration in her limbs.
Mhm. Mhm.
And then she shared, well, actually, this reminds me of when I came out of surgery from my cesarean, and my body was very shaky, and they everybody was trying to help me stop that, give me a sedative meditation to prevent that. I felt very out of control, and so I used it as an opportunity, and I just explained. I said, okay, well, yeah, well, actually, we know a lot more about tremoring now than we did at some other times, and not everybody, this information is not everywhere, so there's settings where people still think. So I just explained a little bit the idea that actually this is one of the body's way of completing stress responses from all kinds of conditions, stressors, traumas, surgeries. It's very, very common. Okay, so she sort of resonant, so that was good for her mind. She got to sort of
Yeah.
hear something and kind of normalize. So I said, maybe next time, if you're curious, I could show you how we could allow a little bit of this and see if we can approach this in a way that feels safe. And she was interested. So then she came back for the second session. And I knew we were definitely not going to need to sit on the wall and do jumping jacks and this sort of thing, because her system very much was wanting to release this. She just didn't exactly know how. So we repeated the same session, starting very soft, helping her relax into breathing, laying there on the table. We didn't even need to do the full hip sequence number 7 from TRE. We just needed to do some very simple things to begin to find some tremoring. And then I showed her how we can start it and we can pause it and we can explain about ideas of self-regulation. And over maybe 15, 20 minutes going in and out, it started to become more, and she started to feel so, I guess the word is sort of like relieved, or sort of like she's
Mhm.
like, wow, this feels so good just to let my body do this. It's like my body's been wanting to do this, but I didn't know how, or actually I thought it was I shouldn't let it do that. And so I said, okay, well, good. So we did maybe 2 sessions like that where we really allowed it to happen. And then I even showed her how she could start to work with this a little bit on her own. All good. So there were probably 3 or 4 sessions where that was the focus. And then she started to tremor. She was already feeling better. She was sleeping better at night.
Mhm.
She had some anxiety and things that I didn't even really know about in the beginning. She told me that she was really feeling really calm. Some of her, some of the hypertonicity in her shoulders was already starting to soften. All right, well, so now I started to do more specific work following the structural integration series. And sometimes she would tremor. and sometimes during our sessions, sometimes not. But her tissues and her nervous system were much more available for the work. And so we completed the 10 sessions. She continued tremoring as a practice. But to me, this was a really good example of where I think if I had not brought in that piece, the tremoring, it would have been missing a huge part of what her physiology needed in order to make some sort of changes. And so to me, that's an example of exactly the kind of clients where when we can recognize that the tension that they carry isn't only, I don't know, it's not just an injury, but it's also embedded it's part of their protective system. And if we can introduce them to the safety physiology and using tremoring to help the body find that sense of safety, I truly believe whether it doesn't matter if you're a structural integration, if you're a physiotherapist, if you're a craniosacral therapist, if you're a yoga therapist, I'm totally confident any modality, a massage therapist, any of these things are going to be improved if the results are going to improve if the person also knows that tremoring can be a very important part of their sort of progression. So anyway, I thought of that because of her story of that she had been taught that tremoring was bad, and so she needed to see that it's a very natural part of the system in order to really benefit from that.
Yeah, and it is amazing how integrating tremoring can actually really work deep with
Right.
the physiology. Also, like we were sharing stories how we integrated tremoring into our work and into like manual practice and manual therapy, structural integration processes. But also I was thinking about, and this is another story of mine, when tremoring was not eventually something that I integrated into manual therapy. However, I really wanted to. But the client that I had, she was like so protected by her body. She was so protected by her nervous system that we couldn't even start working with manual therapy techniques. When she first came to my practice, she was explaining she visited already a few physiotherapists and also manual therapists. She had a severe pain around her shoulders and around her neck. She was earlier in her younger ages like a professional kickbox sports athlete, so she was very well trained in her body. Also, she was very conscious about how her body works, and she was having a very difficult time at that time with some divorcing and some other like really really bad circumstances in her social life. And what she learned earlier, that if I train my body, that's also a way of releasing stress and working with my stress and difficult situations. So she was really disappointed because she was trying to go to the gym, doing some workouts, but she couldn't, because after a couple of minutes, her body started to ache so bad that she had to stop training. And this is when she started to see a physical therapist and another manual therapist, but they couldn't reach anything at all. I mean, she couldn't get any better with the techniques. And this is when I met her, and she actually came to have a different kind of manual therapy. But after I listened to her story, and after I examined her, I was like, okay, I know that you came to have a manual therapy session with me, but are you open to try something different? And actually, we were doing the same thing on the treatment table without doing any manual therapy sessions because her body was already resisting to that. So I was gently explaining her what's going to happen, and then we started doing the tremoring. And it was amazing that after one session of tremoring, she came back the next time and she started crying. And she was like, Agnes, this was, I don't know, after, it's been, she said, I can't remember for how long, but it's been like month. I couldn't go to the gym and start
Hmm.
doing some workout. And guess what? I went to the gym yesterday and I could do a nice, not a long, not a strong workout, but I could just use my body finally again.
Hmm.
And she was just crying, and I also almost started crying because that was so touching, that was so emotional.
Yeah.
And of course, after that session, we kept continuing with the normal manual therapy routines, also integrating some tremoring into manual therapy. Also, I showed her how she can use this as a self-helping tool and just doing the tremoring at home herself. So, and I wanted to share this story because when we are using tremoring, and this is also part of our training that, of course, you are showing some manual therapy techniques, how we can use that alongside with tremoring, but also you're going to share some knowledge about nervous system and also about how our body and physiology responds and how our fascial system responds to threat. And in this case, it was really important to have a certain neurobiology background and
Right.
understand how our nervous system reacts when we are in threat or when our body feels we are in threat and danger. And just to know the right sequence, what is the next tool from our tools, what should be chosen from those wonderful tools and techniques that we already have,
Right.
so that we can give not just a nice session to the client, but also give hope that she or he is going to get better. And I often experience this, and this is why I just love integrating neurogenic tremoring into my practice.
Hmm.
That besides being able to help on a different level, the biggest benefit for the clients that I can see that they get back hope. They
Right.
became hopeful again. They feel like, okay, there's something we can do after a long period of disappointment.
Right.
Yeah.
Right.
So, if you don't mind just sharing a little bit
Yeah.
about
Uh, Yeah.
like
Sort of.
how it comes together with the fascia, and also as it's an evidence that fascia actually is important part, and fascia release is it's nice to use as a manual therapy technique or just something to work with,
Right.
but we rarely talk about how it goes on, how this thing goes on, like how fascia is actually connected to the nervous system and why it is important to treat them like together.
Together. Right. Well, no, I love that question. I love that topic. I mean, that's excited me for the last 15 years. To me, what part of what was so exciting when I discovered TRE was I then, in a way, it opened up my awareness to what I call sort of the neurobiological revolution of, uh, that kind of maybe started around the development of polyvagal theory in the late 1990s. Um, but so basically, and I approached my body work not so much from the medical types of, not from a physiotherapy or not from an osteopathic perspective, but from traditions that were a little bit alternative. So Rolfing structural integration, Feldenkrais movement work, bioenergetics therapies, these kinds of things So in the, from like at least in the United States and maybe somewhat beyond, but at least in the United States, from like the 1950s to the end of that century, the end of the 20th century, was a big explosion of mind-body therapies, and part of what was kind of called the human potential movement,
Mm.
and all this and that. But and there many really useful body-mind insights were came through these modalities. However, the the neurobiology was sort of not there yet, and so they didn't exactly know why all of these things were helping, and why
Mhm.
is the body connected to the emotions, and so they had some, they knew it was, but there wasn't some good explanation. So when I discovered TRE, it opened me. I then learned, wow, there's a whole world of things to learn about the autonomic nervous system. And so people like, of course, Dr. Briselli, but also Peter Levine from the somatic experiencing world, did a lot of explaining why protective responses, how it relates to the threat response cycle of mammals in general, and connecting to animal biology and comparing that to human biology. So looking at the stress sort of research, and then, of course, then leading us to Stephen Porges, the developer of
Mm.
polyvagal theory, which was
Yeah.
kind of updating our, bringing us a more nuanced understanding of the autonomic nervous system, and especially understanding the role of safety, and also the different kinds of stress responses that can happen due to stress and trauma, and how they can show up in the body. Well, then, of course, Bessel van der Kolk published his very important book, The Body Keeps the Score, which was sort of connecting the world of psychotherapy into body-based approaches like yoga therapy, and bottom-up psychotherapies like Peter Levine's work. So we
Yeah.
started to, so between the early 2000s, the 2010s up till now, there just continued to be the really useful unfolding of sort of the science of things. And in some ways, we keep getting even closer together, because now what we're starting to see is that the people who are studying fascia in the body, and I mentioned earlier Robert Schleip, big in this field. He's a Rolfer who then went on to really study what are the mechanisms of explain why is fascia important, and what do we know about the neurology or the nervous system side of it. So
Yeah.
Robert Schleip was sort of a researcher who set up the what's called the Fascial Research Congress, which is a symposium that happens every several years. I don't remember when it began, but maybe perhaps around 10 to 15 years ago. So we have the fascial researchers over here, and then, of course, we have Stephen Porges and the polyvagal theory people, Dr. Briselli, Peter
Yeah.
Levine. And then, very usefully, last August, in New Orleans, Louisiana, in the United States, at the most recent Fascial Congress, uh, Stephen Porges and Robert Schleip, they were the kickoff presenters, the keynote presenters for the symposium. And what one of the major themes of this conference was uh, understanding increasingly the the direct connection between our stress system, what we might call the autonomic nervous system, is directly linked into our fascial system, the fabric of our muscle and our soft tissues of our body. And
Yeah.
so a couple of really useful kind of studies came to light. Like, so for example, um, Robert Schleip talked about his research uh, over over a couple decades now, where he was able to prove that the fascial system, so our connective tissue, has its own kind of contractile fiber called a myofibroblast.
Mm.
So they're cells that can contract, sort of in the same way muscle fibers can contract. Well, fascia can also contract, but the difference is our muscle fibers contract due to a conversation with our motor
Yeah.
cortex in our brain, but our fascia contracts or releases according to the state of our autonomic nervous system. So it's not a conscious thing at all. Our fascia is being dictated by what's happening in our autonomic nervous system. And so
Yeah.
this is part of what Stephen Porges was talking about as well. And there's a few just very interesting case studies, like one where they tracked a person over about a little more than a week, and one good place to measure to look at from the fascia is in the lower back, the thoracolumbar fascia, a big sheet of fascia covering, connecting from the sacrum up to the sort of middle part of the spine, of kind of a sheet of fascia. And it turns out that 40% of the nerves in the thoracolumbar fascia are connected to our sympathetic nervous system. So if we're in a fight or flight response, it shows up as tension in our thoracolumbar fascia, or basically our lower back. So we think about sort of back pain and stress. It's showing us this real clear connection. So what they studied was they took a person and they measured the tension of the lower back, the thoracolumbar fascia. And then I don't know how this happened, but a big stress happened, a big, stressing type of response.
Yeah.
And then they measured over the next few days, and it took 48 hours. So it was a delayed effect. And 48 hours later, the thoracolumbar fascia showed an increased tension. Again, not the muscle fibers, but it was the fascial contractile fibers themselves contracted, and they held this tension. And
Okay.
then over the next 5 days, it sort of gradually released as the nervous system relaxed and it came back into balance. So this was a really useful case study that demonstrates directly how the stress response we have right now is affecting our body not only today but over the course of this week. And sometimes there's a bit of a delayed response in these kinds of stressors. So that was a really useful one. And then they also presented a study that told us that where they measured people with clinical depression, they measured the thickness of the epimysium, or the layer of fascia on the surface of muscles. And on average, the depressed group had about twice as thick fascia as the non-depressed group. So that's an interesting finding as well, because we talk about, think about sometimes how we describe things. Like if you're feeling depressed, you might say you feel heavy, or you
Yeah.
feel sort of sluggish or something. And then if you start to feel better, you might say, oh, I feel lighter, I feel more free. Well, these differences in our feeling tone are probably very much related to what's happening in our fascia as well. So anyway, I'm really happy to see the scientists involved with the nervous system, and the scientists involved with the musculoskeletal fascial system talking more, because it's becoming more and more clear how much they relate. And so when I talk to body workers and manual therapists, they know a lot about physiology, they know a lot about fascia, and this was true for me too. But they don't know much about the stress system. They don't know too much about that stress is very biological, and it has very predictable stages and progressions, and that part of our job as a practitioner can be to help somebody move through the stress sequence in a way that their autonomic nervous system comes back into regulation. And so body workers might think, oh, that's somebody else's job to worry about the autonomic nervous system. But why is it somebody else's job? If you're a massage therapist, if you're an osteopath, why can't it be part of your job to help somebody's nervous system come into regulation, stay in regulation, and then give them tools like tremoring that they
Yeah.
can use in a self-help way to really benefit their system. So this is sort of the kind of the theory pieces that I think are really valuable to bring to bodywork population, practitioners.
Yeah, this is
Yeah.
amazing how actually the body just follows the act of the nervous system. So this interconnected way of working together and supporting each other, I think this is amazing. And I really liked how you explained it and how you said that sometimes, yes, we body workers, we manual therapists think that, okay, this is someone else's job. And I really would love to talk a little bit about this a little bit more, because I think for until maybe today or until nowadays, it was kind of true that we thought that it was someone else's job. And I really find important uh, to talk about how it is not true now, since, as you explained beautifully, how it developed the nervous system, how we have really great people just digging deeper into the neuroanatomy, neurobiology, and how actually it affects our whole body system. And not for long ago, I think that it was kind of evidence, and everybody thought that if we talk about stress and trauma, this is something which needs to be sorted out in our head, but not in our body. And you were talking about it beautifully, how this perspective changed in the last few years, how actually we are talking more and more about that this isn't true anymore, because the people you mentioned, like Levine, Porges, all these wonderful researchers, found out that actually trauma and stress doesn't live only in our head, it lives in our body. And of course, we can learn a lot about neurobiology, anatomy, but maybe this is which needs to be really highlighted. And this is why it makes sense for manual therapists and body workers as well, why we really need to integrate it and why we need to stop thinking of stress and trauma as someone else's job, because it affects the body. And we have a beautiful profession, a beautiful job to work with the body. And since the science says that stress, which affects everybody because it is part of our life, so we really don't need to go too far to think of like really bad traumas, even if it's just like a daily stress which affects us. It is going to affect our body. And this is why it is so important, I think, to start to integrate something, just to find a new perspective, just to find a new tool which actually helps to integrate this new perspective, that we are not alone with the body in our practice.
Yeah.
We are actually supported with great tools which eventually elevate the effect of our work.
Right.
So if you
Yeah.
have any other
No,
ideas, because I think
100%.
we shared great case studies, but maybe some of our listeners might think that, okay, this is still something very connected with trauma. I don't really want to work with people with trauma, or I don't really want to work with people like who's got severe stress, and maybe they should also see a psychiatrist or other professional. So what is your opinion like?
Well, yeah, well, my opinion is that, I mean, I'm very, very glad um, that there are psychotherapists and psychiatrists. And I mean, so when it comes to very significant stress and trauma and post-traumatic stress, um, it's not it's not an either or, having the specializations, the trauma specialists, um, working in a more psychotherapeutic way. Wonderful. Wow. God bless the people who do that work. And for bodywork manual therapists who want to incorporate this type of work, tremoring and a nervous system lens and stress-based work. I mean, in a way, you of course, like all of us, we can decide, sort of where our the scope of practice falls. But what I would say is that uh, almost every person, 100% of people walking around, have some degree of stress and some degree, probably even some trauma. Sometimes you talk about big T trauma and little
Yeah,
T trauma. And
yeah,
I haven't really met anybody who I don't think has some of this. So I think there's a huge need for nervous system work when it comes to very acute trauma and very, then the role of the mental health professionals and is a very critical role. I'm very often working in tandem where they're doing that kind of work, and then I'm working more at the physiological level, and I
yeah,
sometimes even in conversation with those other professionals. So, that's part of what we'll discuss in the seminar is just where do we fit in. But the biggest message I have is that stress is not some rare thing. So it's everywhere. It's affecting the it's affecting your patients whether you know a lot about stress or not. It's there in
yeah,
the room. It's there in the room with you. So
true.
so why not take some time to learn a little bit about it and have some very practical ways to work with it. And then I think what I'd like to sort of share before we kind of wrap up a little bit is just a little bit about the seminar, because I think what I always tell body workers is, look, you're well trained in the body, you're well trained in holding space, staying grounded, you're well trained as a facilitator. So expanding your view to be able to recognize and teach about the nervous system, it's not that's not so difficult to learn a little bit about and to teach, and then and to work with tremoring with your clients is not such a big step for body workers. And so what we'll be doing in our 4-day seminar, one, will be doing the theory. Two, we'll be doing the sort of the elements of safety. How do we introduce this in a way that it's very regulated, it's very safe, it's not moving too quickly for our clients? So there's those two pieces. And then probably half of our time is just hands-on experiential time working with each other in the room. And I'm so excited about you found a great venue. We're going to be a small group. I think we're only going to be, I think, maximum 12 people. So I'm excited for that because it's in a way going to be an intimate space where we can both do this learning piece, but we can apply it. And to me, through and lots of conversations I've had with Dr. Briselli about this is that for body workers and manual therapists, like you don't need a 2-year training about tremoring and stress. You don't need to go become a psychotherapist if you want to work with the nervous system at all. We'll help you learn the information and the methods of applying it right there within your treatment sessions. And the way that you and I are presenting this neurogenic tremoring for manual therapists, it's just very specific to how we will use tremoring in the bodywork setting, different than in TRE. So TRE are learning to teach it to a general population without body work. They're learning to teach it in group settings. It's a more general, it involves more of the movement exercises. Those are pieces we're not bringing into neurogenic tremoring for manual therapists because we know that when somebody's relaxing on our table and we've already established safety, as you said earlier, we don't need to prime the body through movements and stress positions, which are beneficial in some environments, but usually not necessary in the manual therapy context. If we can get the person to relax and tune into their body, and then we can support them with touch, and then the process of inviting the tremoring, waking up the tremor response in the therapeutic space of a manual therapy room is a perfect place to sort of bring this into view. So that's why I'm excited about this series. It's something I've been developing for a long time, a lot in conversation with Dr. Berselli. We were about to do this program together in March of 2020, but it was, as if you might remember what happened in March of 2020. So that program didn't happen. But I'm very excited to be bringing it back here in Hungary, also doing the same program in Romania, and then I'll be bringing it to the United States in the following year, in 2027. So, to me, such an exciting thing. What would you like to share, just kind of as a closing message, or leave us with something, I don't know, inspirational, or how you're inspired? What would you share?
Well, I am very much inspired, and I'm really looking forward to meet the whole group who are going to join us to just experience this wonderful technique. And I feel very honored to be the host of this course or seminar for the very first time in Hungary. And I feel very grateful that I can offer a new tool. I can offer something which helps to upgrade the work of my colleagues. So I feel very, very excited, and I'm really looking forward to just meet in person and just start this wonderful journey together.
I have the feeling we're going to have a lot of fun, and I'm sure, and we'll be teaching a lot to the group we work with, and we'll be learning. That's what I like about this work.
Exactly.
We get to be around professionals who are curious and get to share from their own experiences, and I think it's going to be an extremely rich. We're going to just be growing our community of people who are doing this work. So I'm so excited to be doing this with you, Ágnes.
Me too. Me too.
Yeah. Very good. Well, let's wrap here, and maybe we'll do a follow. Maybe after our program, we can do a follow up, and we'll share what we'll
sure.
we'll
Why
share
not?
how it went. Yeah. All right. Very good. Thank you.
That's it for today's episode. We hope you found inspiration and new insights into the power of neurogenic tremoring.
If you enjoyed this conversation, make sure to subscribe, share, and leave a review. It really helps us reach more people interested in this transformative work.
And if you want to dive deeper, connect with us. Or to learn more about our sessions, courses, and upcoming trainings, head over to neurogenicintegration.com.